Welcome to Voices in Health. I'm your host, Dr. Barbara Kostick. Today we're going to give you an update on Washington Hospital's journey to achieving magnet status recognition. The American Nurses Credentialing Center, the ANCC, created its magnet recognition program in the 1980s to recognize healthcare organizations that provide quality patient care, nursing excellence, and innovations in professional nursing practice. Magnet designation is the highest international recognition for nursing excellence. As its name implies, this award acts like a magnet to attract and retain the top nurses in their fields. Our first guest is Martha Googleman, registered nurse, Washington Hospital's Magnet Project Director, and Senior Director of Clinical Workforce Development. Welcome back, Martha.
Thank you, Barbara. It's great to be back.
Tell me, what's been happening over the last couple of months with the magnet status?
Oh, so many things have happened since I was here last. We have fully implemented our evidence-based practice, research council, and we have really taken off, and the staff are just so enthusiastic with all the great work they're doing.
That's wonderful. Tell us, what are the goals again about this magnet and the magnet journey?
The goals of Magnet are to improve professional nursing practice, to do research, evidence-based practice, to make sure those best practices for nursing are disseminated not only in our hospital, but throughout other hospitals and be available so that nurses will be able to use those in their practice.
How did this get started at Washington Hospital?
Well, quite a few years ago, Jan Wood, who is our Chief Nursing Officer and Senior Associate Administrator, was very interested in looking at what we could do for the nursing shortage that we had at that time, which was the late 1990s, early part of the 2000s. And we were looking at the literature and decided that magnet status was a great way to improve recruitment and retention. But since then, the whole program has grown to be more about quality.
Wow, that's interesting. So it started out as a workforce retention program and actually developed better patient care and better patient outcomes, huh?
Exactly, because we continuously have to raise the bar on our practice.
So what's all involved in this journey? It must involve a lot of different departments and different people in the hospital.
It does. It's a huge effort. But we're very blessed at Washington Hospital to have always had great support for nursing and professional practice. And so we have just improved upon that. We have improved upon our long-standing shared governance structure. We have fully implemented evidence-based practice, research. We have looked at our care delivery system and our care model to make sure it meets the needs that we have for the current patients. And we have been doing a lot of training with staff. Staff have been very empowered to be leaders and decision makers to take care of the patients right at the bedside. So we believe that every nurse at all levels are leaders and decision makers. And they have fully embraced that and just taken it on. And our patient care outcomes have certainly improved. Our nurse satisfaction scores have improved. And all of our nurse sensitive indicators are improved as well.
It seems like the journey to magnet status has become a very valuable process. Can you give us some insight in what has happened now because of this process and what we gained from it?
Well, the research shows that, and we've seen the same thing here at Washington Hospital, that just by being on the journey itself improves the quality of nursing practice in a hospital. Whether a person ever reaches and gets the actual designation, that care improves, that professionalism improves amongst the staff, that staff start fully implementing their scope of practice, and that patient outcomes improve dramatically.
I understand that a magnet site visit is coming up. What is entailed in that?
Well, the magnet site visit will be the culmination of all of the things that we've been doing over the last several years, such as doing our magnet application. We have written a document that was accepted, and I will say that we are one of only 2 to 3 hospitals since the magnet program began that had their documents submitted without additional documentation requested. So we're so proud of that. And we were one of the first in the Bay Area to submit an electronic document. So the site visit is the next step. We were able to go directly to site visit, and that will be clarifying, amplifying, and verifying what is in the written document. And it's the time that nurses really get to brag about their practice, that they get to showcase all of the wonderful things they do each day, and they really get to shine.
Wow, thank you, Martha, for giving this overview. When we come back, we'll be talking to a few nurses here at Washington Hospital to get their views on the journey toward magnet status.
Washington Hospital has applied to the American Nurses Credentialing Center for the prestigious designation of Magnet. The Magnet designation recognizes excellence in nursing services. Patients, family members, staff, and interested parties who would like to provide comments are encouraged to do so. Anyone may send comments via email, fax, and direct mail. All phone comments to the Magnet Program Office must be followed up in writing. Your comments are confidential and never shared with the facility. If you choose, your comments may be anonymous, but must be in writing. Comments must be received by July 18, 2011. Send by mail to American Nurses Credentialing Center, Magnet Recognition Program Office, 8515 Georgia Avenue, Suite 400, Silver Spring, Maryland, 20910-3492. By fax at 301-628-5217, by email at magnet@ana.org, and by phone toll-free at 866-588-3301.
Welcome back to Voices in Health. Joining us are three nurses from Washington Hospital: Fritz Bushman, RN, Lita Hughes, RN, and Jimmy Chang, RN. Welcome, and thank you for joining us.
Thanks for having us.
What would it mean to you professionally if Washington Hospital does receive the Magnet recognition?
I think it's something that we can be very proud of. Just in California alone, there aren't that many hospitals recognized for magnet status, and if we had it, I think it's just something that we could toot and holler about, something we could really be proud of.
Yeah, I think it's a real good chance for us to show what we do well. I like that. Proud of what we do.
And that we already are magnet nurses in hospital, and that we are just finally being able to say, we do this. This is what we do here. We've been doing this. We've come through the process of doing this, and so that would just be that end product to just say, yeah, we got to apply and we got
And now we're
selected.
recognized
Exactly.
nationally.
Yeah.
And what have you done for the Magnet process? What have you had to do?
Well, I think I came later in the journey. I've only been a nurse for 3 years, but I think I get a fresh look at what's been taking place at other hospitals, other magnet hospitals, and seeing the work that's being done. And when I came to this hospital and I saw the work that was being done here, I thought, you know, we're operating at the same level from a nursing standpoint. And I was just proud to be affiliated with this organization. More recently, I involved myself by participating on the magnet communication team. So trying to educate the nurses, making sure they understand what we're doing, what they're doing, more importantly, and helping them to understand that they're part of the process.
Gives us a chance to look at what we have been doing, to examine it, to go through it, to improve it, and makes us look good.
And really to look at our outcomes as nurses, to just get out there and look and see what it's been for our patients. I mean, that's what we're all here for. We want that improvement in the care, and I think here at Washington, for me, I've been involved in the clinical councils, unit-based council that we just started, which actually put the whole thing together for me as far as from administration to that bedside nurse, you know, that can get that information out there. Because information here needs to be important, and we need to know that we're clear with all the new knowledge that comes out, and that administration is communicating with all levels, and that's the way to do it. I mean, if the nurse comes to unit-based counsel and says, hey, this is what I see going on, she knows that's going to go up and somebody's listening, and the hospital is paying attention and processing that. So that's exciting for me.
So it's actually changing your practice environment then, isn't it?
Absolutely.
Yes,
Oh, yes.
certainly.
What's your best change in the practice environment because of this?
I work on the Center for Joint Replacement, which I feel like I've been very lucky to be part of that from the ground up. And we have looked at many of our policies and procedures, and we have gone through them with a fine-tooth comb. We have improved them. We've kept what was good. So that has been a great help.
And Jimmy, you said that you'd been at other hospitals that had magnet status, and so you felt that Washington met that standard and wanted to help push for it too.
Yeah, absolutely. The things that I've noticed that other hospitals had in place was that there was an empowerment that nurses had in order to voice what was going on from a nursing practice standpoint, and an ability to dictate how the environment can be changed so that the practice becomes better. And I felt even from the get-go when I joined Washington Hospital 3 years ago that was in place. Even as a new grad, I felt that my voice was heard from the beginning. So it's something that I feel most nurses experience as well.
So you felt a real sense of empowerment, a sense of being part of a medical team. Has that changed over the years in nursing and how nurses look at their practice and what they're doing now?
Oh yeah, I think team approach is something big that we do on the Center for Joint Replacement, but that is something that has changed in nursing a lot.
I think the multidisciplinary part of it has really changed, that we have included everyone as far as, respiratory therapists. The doctors now ask, what can you add, or what are you finding out that might make the practice better? I mean, even our evidence-based practice projects that we had done last year, that brought a lot of change to the hospital, and doctors were on board on that, and so were other multidisciplinary personnel. So I think we all got
Yeah, I think
empowered by that.
That's one of the biggest changes we've seen in nursing is the multidisciplinary approach. And that just opens up so many avenues, and it just really improves it.
Well, and people talk a lot about nurse burnout, because nursing is so intensive nowadays. Do you think something like this would help with that too?
Definitely.
Oh, yeah.
28 years or almost 28 years here, I'm not burnout at all. So, I mean, I think that encourages you to stay in nursing, especially right now with all the learning that, research is out there, evidence-based practice. We have new, the mentor program for evidence-based, and we're going to be getting the fellowship. I mean, that's exciting for any nurse. I mean, I'm out there trying to recruit them all the time, because that fellowship with Ellen and Byrne, who are coming in, these are the, the evidence-based professionals, and it's excellent for any nurse that could get on that and get that fellowship and get the learning. I mean, here at Washington Hospital brought that to us.
Yeah, and there's so much more support. That's what's changed over the years too. There's support for the individual nurse, which really then you aren't alone. The burnout isn't as much of a problem. Works very well.
I think burnout occurs when
it
nurses, I mean, I don't come from a perspective where I've been in nursing for a long time, but burnout probably occurs because nurses get into a mode of static lifestyle, static job. But here at Washington, I think there's a structure in place where we're empowered to get involved in committee work, different task forces. There's also different credentials that certifications that we can achieve. So that gives motivation to a lot of the nurses so that they can improve their own practice.
There's always been a lot of encouragement to get involved in a lot of different things. Shared governance, that's been many years at Washington Hospital now, and that I was involved in that right from the beginning. That really adds a whole nother layer to how you feel about your job when you get involved in things like that.
Right, because nursing doesn't stop just in the hospital. I mean, we're nurses outside the hospital. Community looks at you. Your family members look at you, for information, and so you have to be involved. I mean, that's what nursing is about, and we need to know that.
Yeah, community is a big part of it, and therefore we do look at our surveys, and patient satisfaction is very important. We look at that a lot.
You've mentioned, the opportunities, you've mentioned empowerment, you've mentioned being listened to.
Yeah. Well, I've only been a nurse, again, like I might sound like a broken record, but only been a nurse for 3 years, but each year there's been an opportunity that surfaced that I was able to get a hold of. I think within my first year, after my first year, I was already precepting new grads, and that was something very rewarding. Then I became a charge nurse. Now I'm involved in shared governance, and I think with each step, there's a sense of an accomplishment. But I think I mainly got into nursing because prior to getting into nursing, I was in accounting and finance, and I wanted to interact with people. And probably the most rewarding thing still is once we send patients home and they come to the floor, whether as visitors or as patients again, they're part of the community and they're part of who we are working with and who we're trying to take care of. And so it's the patient interaction and the community interaction that's, for me, is most rewarding.
And for me, it's education. I mean, I love to teach. I love to teach just, the patient, the other nurses, and to be able to get out there and say, this is the information, and how can they receive it? I mean, how, and by knowing that someone receives information is to be able to see that they've changed something, they've either changed the way they've, exercise or their diet, or going out and presenting. Like I said, I was involved in that caregiver class, and that was a big community thing.
And what I like about this book, it is a guide. It doesn't tell you which ones to use. It's not going to...
I did the class, and I had a friend call me from Sacramento to tell me that an old friend of ours, I hadn't seen him in ages, had called her that he had seen me on the program, and he called because his mother and him, he was taking care of his mom, and she was dying of cancer, and he needed that program, and there it was. And then he saw me, so she got a hold of me, and I ended up going to her funeral because he wanted me to be there. And that was just from that community class, and so I knew that it reached somebody because he had not seen me in a long time, but called me, from that. So that he wanted me to know how important it was to see me on there, and that information helped him.
Oh, that's wonderful.
So
Well, I think one of the things I'm most proud of is what I'm involved in now. And 12 years ago, the Center for Joint Replacement was opened, and we started with a very small group and Dr. Dearborn, and it has grown into a very successful, large, very busy operation. And that has really been a pleasure. And we've heard from so many patients that they come in the door with their bad knees and bad hips, and in 2 or 3 days they walk out. That's really a pleasure.
And not to mention, Fritz, that they go ahead and tell everybody, their friends, and I mean, you just hear it from our own family members, like, oh, I got my knee, I'm telling my aunt so-and-so.
Yeah, it's been great in the community. We've really, it's a pleasure.
You've been honored nationally, right?
Yes,
Yes,
That's
right.
great.
We were honored for our patient satisfaction scores and so on. So that's
No,
first
it's a
in California.
wonderful
And,
program. And it is amazing how medicine has changed over the years. You can, look how long your mother was in the hospital when you were born compared to how mothers go now. They definitely need education before they leave. If we are successful in achieving magnet status, how will it change what Washington Hospital does here?
Well, the pressure's on. We have achieved it, and we need to keep it. And that will be our goal, to continue to grow.
And to continue to improve.
I think from a public perception standpoint, if not already the case, Washington will be recognized as a destination hospital because the accreditation that nurses give, it'll represent that Washington is providing the epitome of nursing excellence. And we know that.
That's true.
I agree with that.
Already,
I
but
think
the
same.
perception will be out there.
And the community needs to know what that means, and they need to understand that what the nurses bring, to their care, and how they've gone nationally or California standards, or we're meeting or beating that, and our outcomes are on, they're out there, they're for the public to see, and they will choose to be here and want their care and their families to come to Washington.
Well, I know you three played a great role in getting the magnet status, and your enthusiasm shows on how important it was. So thank you very, very much for coming today and telling us about it.
Thank you.
Thank you.
We'll be right back to take a look at what achieving magnet recognition will mean to Washington Hospital.
This is my medical clinic.
This is my gamma knife.
This is my emergency room.
This is my coronary stent.
This is my hyperbaric chamber.
This is my digital imaging center.
Washington Hospital is a leader in providing advanced medical care. Whether you're a community leader or just a proud community citizen, Washington Hospital is owned by you.
This is my hospital.
This is my hospital.
This is my hospital.
Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Welcome back to our update of Washington Hospital's journey to achieve magnet status. Rejoining us is Martha Googleman, Washington Hospital's Magnet Project Director. Martha, let's look outward. How will magnet status affect the community?
It will be very positive for the Washington Hospital community because the community can feel assured that the nurses taking care of them are professionals and that they're well educated, most of them are certified in their area, and they're extremely well trained. And along with that, part of the magnet sources of evidence requires that nurses be involved in the community and involved in community outreach projects, which we so are, and we'll be doing that more and more as time goes on.
If we do achieve magnet status, where and how does that put Washington Hospital compared to other hospitals in the state and nationally?
Well, locally, there are only 4 hospitals that are magnet recognized. Hopefully, we'll be number 5 in the Bay Area, and so it's really an elite group.
What does magnet status say about the environment for patient care?
It says that it's a very professional environment, a collaborative, collegial environment, that we're working well with the other disciplines of the hospital. Mm-hmm. Everybody's contributing. There's excellent physician-nurse relationships. All of that equals to improved patient outcomes and better patient care and better patient satisfaction and more satisfied nurses.
Well, and you know what I see now in medical care and where it's going, they talk about a medical home and they talk about a medical team. And I think the hospital and the nursing staff are a big part of that team. So it seems like we're finally all playing the same record, all on the same CD, mm-hmm. trying to get to the same place. That's great.
Exactly. As part of Magnet, it's a huge push toward higher education, which goes along with the IOM report.
And that will improve quality, won't it?
Absolutely. Absolutely, because the Magnet program is very outcome focused.
And what happens after you become Magnet? Is there something that happens to you then? Do you become super magnet or what?
Well, we wish we were super magnets, but no, it's maintaining the designation. Mm-hmm. So in order to do that, we continually have to improve our quality, competency, and professionalism through all of those things that we have been doing already. What happens is the bar is raised because other magnet hospitals are doing better and better. So that means in order to maintain our status, we have to continually improve. So what the public should expect is a better hospital as time goes on.
With taking care of the patient education, mm-hmm. and
exactly.
resources for the community.
And resources for the patient and nurses making decisions mm-hmm. right at the bedside. So it's excellent for nursing.
Any final thoughts?
Well, I would just like to say that I would like to thank you for having us on the program and for being along with us for the journey. And I would also like to thank everyone at Washington Hospital and in the community because it took everyone to make this possible, to get to the site visit, and we're anticipating that that will go very well. And everyone working together as colleagues has made this a great experience. And nurses could not be nurses without everyone that works with them as a team, and we're very proud to be here.
Thank you, Martha. It's been a pleasure working towards this common goal. As we have seen, earning the ANCC magnet recognition is a major accomplishment for the hospital and the district. We are extremely proud of our excellent nursing staff at Washington Hospital today. Magnet status will help us attract additional high-quality nurses in the future, and that will help ensure that we will continue to provide the best possible patient experience and treatment outcomes. Thank you for watching. We'll see you next time on Voices in Health. For more information on magnet recognition, please visit the American Nurses Credentialing website, nursecredentialing.org, the Center for Nursing Advocacy website, nurseadvocacy.org, and the Washington Hospital website, whhs.com.